You're listening to Audiology. Support our work on Patreon, and be sure to submit your requests for topics in the comments below. Now presenting the Black Death. The Black Death was a catastrophic bubonic plague outbreak that ravaged Western Eurasia and North Africa between 1346 and 1353, and is noted as the deadliest pandemic in recorded human history. It brutally decimated between 40% and 60% of the European population, killing an estimated 25 to 50 million people at its height in Europe from 1347 to 1351. The plague, caused by the bacterium Yersinia pestis and carried by fleas, likely shifted to a more direct human-to-human transmission through airborne particles, resulting in the even more lethal pneumonic plague. This marked the onset of the world's second series of plague pandemics. The devastation left by the plague had far-reaching consequences on Europe's societal, religious, and economic fabric, dramatically altering the continent's trajectory. Tracing the origins of the Black Death has led to contention, but genetic evidence suggests that the bacterium evolved in the Tian Shan mountain region along the border of Kyrgyzstan and China over 2,600 years ago. The specific starting point and path of the outbreak are less clear, with various theories suggesting it began in places like Central Asia, China, the Middle East, or Europe itself. Europe's initial contact with the plague is believed to have occurred in 1347, when the army of Jani Beg of the Golden Horde besieged the Genoese port of Kaffa in Crimea. Infected fleas aboard Genoese ships may have carried the plague from Crimea, transmitting it through maritime routes to the Mediterranean and beyond, impacting North Africa, Western Asia, and the rest of Europe. However, further evidence points to an often overlooked pneumonic form of the plague as the primary driver for the rapid interior spread, rather than rat-flea transmission. Recent discoveries in present-day Kyrgyzstan show a spike in deaths around the 1330s, suggesting that early spread might not be linked with 14th-century Mongol invasions as once thought. The Black Death wasn't the only crisis of the late Middle Ages. It followed the Great Famine of 1315-1317 and wiped out 30% to 60% of Europe's population and a third of the Middle East's populace. This period also experienced continual plague outbreaks and other challenges known as the Crisis of the Late Middle Ages. As a result, European population numbers didn't return to their pre-14th century highs until the 16th century, with sporadic plague recurrences persisting globally well into the early 19th century. Part 1 Names. Writers from Europe who were alive during the time of the plague often describe the disease using the Latin terms such as pestis or pestilentia, meaning pestilence, epidemia for epidemic, and mortalitas for mortality. In English before the 1700s, people referred to the event as pestilence or great pestilence, the plague, or the Great Death. After the outbreak, terms like the first moraine or first pestilence were used to differentiate this mid-14th century occurrence from other plagues and diseases. Originally, during the actual outbreak, no European language called the 1347 outbreak Black Death, though the term had been occasionally used for other lethal illnesses before that time. The specific association of the term Black Death with this plague didn't appear in English until the 1750s, first recorded as a translation from the Danish Den sorte død. In the 15th and early 16th centuries, Scandinavian chroniclers made the expression more common, and from there it entered other languages, sometimes as a direct translation, Svarte Dauði in Icelandic, Der Schwarze Tod in German, and La Mort Noire in French. Earlier, most European languages had called the plague something that was a variation or linguistic borrowing from the Latin phrase magna mortalitas, meaning great death. The description of death as black is a concept that dates back to ancient times. Homer used it in the Odyssey, referring to Scylla's mouths being full of black death. Later, Seneca the Younger may have been the first to use Black Death to describe a widespread illness. In medieval times, the French physician Gilles de Corbeil used the term atra mors in association with a pestilential fever in his medical writings. Simon de Covino, a Belgian astronomer, also used the term mors nigra in 1350 in his work referencing the plague, although it was not definitively linked to the 1347 event. The historian Cardinal Francis Aidan Gasquet, in a work published in 1893, posited that the Great Pestilence might have been akin to the common Eastern or bubonic plague. He also pointed out that the term atra mors for the 14th century epidemic was found in a 1631 historical account of Denmark by J.I. Pontanus, where it is noted that the name Black Death was popularly used because of the plague's devastating consequences. Part 2. Previous plague epidemics. Studies from 2017 indicate that the plague first emerged in humans in Europe and Asia during the late Stone Age to the early Bronze Age. In 2018, researchers discovered traces of the plague bacterium Yersinia pestis in a prehistoric tomb in Sweden. This discovery is linked to a significant drop in European populations around 3000 BCE, known as the Neolithic decline. The strain of Y. pestis found from that period appears to be distinct from later variants, including those responsible for bubonic plague, which is transmitted by fleas. This flea-borne version was first identified in Bronze Age samples from the Samara region. Historical texts note the symptoms of bubonic plague. An excerpt from Rufus of Ephesus, preserved by Oribasius, suggests that the disease was present in the Roman Empire before Emperor Trajan's rule, which predated its arrival in Pelusium during Emperor Justinian I's reign by 6 centuries. In 2013, scientists confirmed the speculation that the contagion behind the plague of Justinian, which lasted from 541 to 549 CE, with sporadic episodes until 750, was indeed caused by Y. pestis. This event marks the first pandemic of the plague. Furthermore, around 610, Chao Yuanfang, a Chinese doctor, described the sudden onset of a high fever accompanied by swollen glands, referring to these symptoms as a malignant bubo. Another Chinese physician, Sun Simo, who passed away in 652, also wrote about this malignant bubo and a widespread plague in Lingnan, present-day Guangzhou. Historian Ole Jürgen Benedicto postulates that the plague reached China around 600, possibly spreading from the same pandemic that affected the Byzantine Empire. Part 3. 14th Century Plague. Causes. Early theories about the origin of the plague included supernatural beliefs. The medical faculty of Paris thought that the alignment of planets had polluted the air, and Muslim scholars believed the pandemic was simultaneously a test and a blessing from God. Some Muslim physicians were hesitant to intervene in what they saw as divine will, while others used treatments similar to European methods, drawing on the knowledge of ancient Greek texts. The prevailing modern explanation suggests that due to environmental changes in Asia, such as drought, rodent populations moved closer to human settlements, carrying with them plague-infected fleas. This form of the plague was identified by Alexander Yersin in 1894 as being caused by the bacterium Yersinia pestis, which he found in rodents in Hong Kong. The transmission via flea bites was confirmed by Paul Louis Simond. The spread was also influenced by the resistance levels in different populations of rodents, with resistant populations maintaining the disease endemically and non-resistant populations dying off and causing fleas to seek out new hosts, including humans. Research using modern genetic analysis confirmed Yersinia pestis as the agent of the Black Death. Various studies, including those evaluating ancient DNA from skeletons, have demonstrated the presence of this bacterium in remains from mass graves linked to the plague. These findings provide definitive evidence of the role of Y. pestis in the medieval pandemic. Alternative explanations. Due to limited historical data, the exact nature of the plague's spread and its origins is still somewhat shrouded in mystery. Some alternative theories propose human fleas and lice as the main vectors rather than rat fleas. These interpretations often serve as better explanations for the pattern of deaths observed during historical outbreaks. Skeptics have challenged the notion that rat fleas were the primary mode of transmission, pointing out inconsistencies in the archaeological record and the disease's rapid spread, which could indicate direct human-to-human transmission. Transmission. Before understanding germ theory, medieval European hygiene standards were generally poor, contributing to the rapid spread of disease. Streets were dirty, and legislation on sanitation was limited, such as requiring people to announce before emptying chamber pots into the streets publicly. Early Christian teachings also negatively influenced hygiene practices, with many viewing bathing as a potential sin that should be avoided. The origins of Yersinia pestis are traced to China, according to some geneticists, while others suggest more specific origins in the Tian Shan Mountains on the border between Kyrgyzstan and China. The role of China in the plague spread remains debated, with alternative theories ranging from origins in Europe, Central Asia, or elsewhere. Historical records challenge the idea of a pandemic in China during the Black Death, with some epidemics aligning in timing but lacking concrete evidence as being caused by Y. pestis. European outbreak. Plague entered Europe via Genoese traders from the siege of Kaffa in 1347, potentially spread by infected rats or human-to-human contact. It moved rapidly across the continent, affecting cities and rural areas alike, often spread further by fleeing populations. Western Asian and North African outbreak. The plague impacted the Middle East and North Africa, killing off large portions of the population and changing social structures. It spread through the movement of people and infested rodents across the region, entering via different pathways including trade routes. Consequences. The Black Death resulted in a massive loss of life across Europe, with population estimates showing a wide variance due to insufficient historical data. Widespread deaths prompted a vast economic, social, environmental, and religious change. Workers' value and wages increased as the labor force dwindled. The pandemic led to persecution of groups such as Jews, whom many blamed for causing the plague. The pandemic also contributed to the decline of feudalism and may have indirectly influenced the emergence of the Renaissance. The term quarantine originates from this period, where new arrivals to the city of Ragusa, now Dubrovnik, were isolated for 30 and later 40 days to prevent the spread of the disease. Part 4. Recurrences. Second Plague Pandemic. The bubonic plague was a persistent and devastating force in Europe and the Mediterranean from the 14th to the 17th centuries. Historian Jean-Noël Birabin notes that each year during the period of 1346 to 1671, Europe was not entirely free from the disease, although there is some skepticism about the reliability of Birabin's figures. The pandemic saw intense waves of outbreaks during specific periods such as 1360 to 1363, 1374, 1400, 1438 to 1439, and several others up until 1664 to 1667. Although the plague continued to cause suffering, its grip on Europe and North Africa began to loosen by the 18th and 19th centuries, respectively. George Sussman suggested that East Africa was not affected until the 20th century, yet other sources dispute this, indicating that the disease did reach sub-Saharan Africa earlier. In grim numbers, the plague claimed nearly 1 million lives in France during the outbreak of 1628 to 1631, and the toll in 17th century Italy was around 1.7 million. Spain also suffered greatly, with over 1.25 million people dying from the plague in the same century. The Black Death heavily impacted the Islamic world, with the plague appearing almost yearly from 1500 to 1850. While some outbreaks were localized, others spread across vast regions. Algiers and Cairo were repeatedly hit, with Algiers facing significant death tolls in the early to mid-17th century, and Cairo enduring over 50 epidemics in 150 years, the last being in the 1840s. The Ottoman Empire was similarly afflicted, with many plague epidemics recorded in Constantinople and widespread mortality in Baghdad, sometimes losing up to 2/3 of its population. Third Plague Pandemic. Originating in China in the 1850s, the Third Plague Pandemic engulfed all populated regions of the world, with India witnessing over 10 million deaths. Research into the disease intensified when scientists, including bacteriologist Alexandre Yersin, after whom the plague-causing bacterium was named, studied the pathogen in Hong Kong in 1894. Australia was not spared, experiencing 12 bouts of the plague between 1900 and 1925, mainly in Sydney, which led to groundbreaking research on the bacterium Yersinia pestis and its transmission from rats to humans. The United States faced its first significant encounters with the plague in San Francisco from 1900 to 1904, and then again in 1907 to 1908. Modern day. Today's fight against the plague involves methods such as the use of insecticides, antibiotics, and vaccines. Despite the advances, there is a genuine concern that the plague bacterium could evolve resistance to drugs and re-emerge as a significant health concern. A strain of the bacterium resistant to multiple drugs was identified in Madagascar in 1995. Subsequent outbreaks in Madagascar, including one in November 2014, and a particularly lethal outbreak in October 2017 that resulted in 170 deaths and thousands of infections, have demonstrated the disease's continued threat. In modern times, the case fatality rate of bubonic plague with antibiotic treatment is about 11%, though this number could be higher in less developed areas.